When you are a loved one that has Alzheimer's disease, it seems like the whole world is turned upside down. What a challenge to be going through something where you know you're losing your memory. You're going to be losing a lot of your physical capacity and your cognitive skills as well. Fortunately for us, only about 2% of people between the age of 65 and 75 will develop Alzheimer's disease. But by the time you get to 75 or 85, that runs to 20%. And by the time you're 85 years old, about 40% of us will eventually get Alzheimer's disease. The symptoms are really classically related to memory loss. Usually it's a recent memory loss. Our distant memory is pretty good until towards the end of the disease. But the cognitive decline can be awful and really a challenge to try and deal with. And of course the physical decline as well. We make the diagnosis based on cognitive testing, on specialized kinds of scans like functional MRIs or SPECT scans, and by the clinical history. The cause of the disease is probably mostly caused by plaques, by genetic predisposition with the APOE4 gene, and by the neural tangles that we get in the brain in certain areas like the hippocampus, the temporal lobes, and eventually the frontal lobes. We also have a number of toxins. There are a whole lot of toxins in the environment that we don't really expect are going to be doing things to affect cognitive decline, but they do. Things like aluminum and mercury. And many of the drugs that we use, particularly the anti-cholinergic drugs that are used in medicine by a lot of doctors. Things like Benadryl and Dramamine and Nitol and Salmonex. Some of the antidepressants like Paxil, Wellbutrin, and Elavil all can cause problems that look like Alzheimer's disease or aggravate the disease. Many of the drugs as well that are not anticholinergics, things like Dilantin and some of the analgesics that we use like morphine and Xanax, are problems that we have to worry about as well. The treatment for this disease is not very good. The mainstream approaches basically are using a couple of drugs, one called Aricept and the other Namenda. They can help a little bit. They don't prevent the onset of the disease, so there's no point taking it to prevent it. And they may improve our cognition 5, 10, 15% at the most when we have symptoms. The things that work the best are preventive. Mental exercise, keep your brain fit. Physical exercise is really important to keep us from getting Alzheimer's. Our diet is particularly important, and one of the best kept secrets, I think, in medicine is that Alzheimer's disease is like a brownout, an electrical brownout. You know, when you're having a power shortage in an area, what happens is that happens to our brain cells as well. When we can't metabolize sugar as well as we normally do, we need to shift the metabolism from carbohydrate metabolism to burn for energy to fat. So there are things that we can do that will help to do that. Adding medium chain triglycerides such as coconut oil, about 3 tablespoons twice a day. Adding some niacinamide, about 1 gram 3 times a day. And using curcumin, 500 milligrams several times a day, can do a lot to help stimulate our recovery from the electrical brownout substantially. And then using a number of other kinds of supplements, which are really occasionally used, but most of us don't know about, can also be helpful. So we're looking at those kinds of approaches as well. We're looking at Aricept itself, which is a major drug that's used today in the treatment of Alzheimer's disease. Keep in mind, as I said, it doesn't do anything to prevent the onset from coming on. And what it basically does is it protects against losing acetylcholine, which is one of the major neurotransmitters that we lose as Alzheimer's disease progresses. So when we use Aricept and we try to raise levels of acetylcholine, that tends to protect a little bit against the progression of the disease once it's there, and maybe slow that down just a hair. It is really not of a whole lot of good in almost any case because of the side effects. We're looking at 10 to 20% of people who are using this drug have nausea and vomiting from it. We also have things like muscle cramps and slowing of the heart rate, which for some people who already have a problem that way, it could lead to problems with fainting. We lose our appetite some of the time. And then the drug Namenda, which is the other mainstream drug which is used, has its problems as well. What it's designed to do is work against those NMDA receptor sites in the brain that are really glutamate receptors that when there is too much in the way of stimulation, it causes death of the nerves, okay, that are the brain cell nerves that we want to protect. So it may have some small protection there, but its side effects too can be problematic when you consider the minimal gains, things like hallucinations, confusions, headaches, and fatigue. And then lastly, people are using things like the antipsychotic drugs, which in my opinion are a nightmare if you're going to try and use that in people who have Alzheimer's, because very often that's the very thing that makes them decompensate even more, and it becomes a management problem. So when we're looking at the overall approach to managing Alzheimer's disease, we've got to think more in terms of supporting people with lifestyle changes. If you do the things that you can by staying fit and exercising regularly and having a lot of mental activity in your life so that you're engaged in something that causes mental stimulation, and you're sleeping well and you're not too stressed out, your chances of getting Alzheimer's disease, or of it getting worse, will help to protect you. So we've got a tough problem here that's difficult to deal with, and I think prevention is the best approach. But if prevention isn't working because it's already happening, a combination of these therapies can be used by someone who knows both traditional, conventional therapies as well as some alternative nutritional approaches.